All right. Good afternoon and welcome. We will start out with Health Department Director Dr. Lindsay Hughes giving us an update on what's going on.
Good afternoon. Thanks for being here to get an update on the raccoon rabies operation that we've been having happen here in Omaha over the past few weeks. To start out, I would really like to thank all of the partners who have been part of this response. It has been a really big collaborative effort to get this done here in Omaha, and it has definitely been one of the most smooth operations like this that I've been part of. So I would like to thank the Centers for Disease Control and Prevention, the United States Department of Agriculture, the Nebraska Department of Health and Human Services, the Nebraska Humane Society, the UNL Diagnostic Lab, the Nebraska Department of Ag, Nebraska Wildlife Rehab, the City of Omaha, and last but certainly not least, I want to thank all of our citizens here in Omaha that have really come forward to volunteer and to show their support and really help us get this effort underway in a successful way, because without that cooperation this just wouldn't be possible. So thank you all of our partners in our community for helping us here. Just a quick overview for those of you who may not recall the timeline that has set this whole thing in motion. On October 6th, an Omaha kitten that had previously been diagnosed with rabies was confirmed by the CDC to have the raccoon rabies variant, and from there a multi-agency response followed. The CDC began enhanced surveillance testing beginning on October 16th. 130 animals have been tested to date through that effort, and no additional confirmed cases of the raccoon variant of rabies have been detected. To ensure sufficient power to detect local raccoon rabies variants here in Omaha, that testing will likely continue through the month of December, but could possibly go as late as February. The Trap, Vaccinate, and Release campaign by the USDA began on October 23rd, and thus far, 559 raccoons, 23 skunks, 3 cats, and 1 red fox have all been vaccinated against rabies. And the USDA is about to enter the second phase of this coordinated response to stop the spread of raccoon rabies variant. And to give us some more detail on that effort, I have our Deputy Director and Chief of Epidemiology, Justin Frederick, to give you more detail.
So good afternoon, everybody. I'm here to announce today that starting on Wednesday, after the Halloween holiday, the USDA will begin distributing oral rabies vaccine in a 62 square mile area around where the kitten was found. So personnel from Douglas County Health Department and the USDA will be on foot and in vehicles to distribute about 18,000 oral rabies doses. The goal is to provide herd immunity among raccoons near the area where the kitten was found to stop the ongoing spread of this rabies variant. The 62-mile area is outlined by the Interstate 680 running east to west from the Missouri River on the north, with the western boundary being Interstate 680 running southbound until it merges with Interstate 80 and continuing south to the Douglas-Sarpy County line. The southern boundary is Harrison Street, going east to the river and west to the Interstate 80, and the eastern boundary is the Missouri River Iowa state line, but we are omitting Carter Lake. The goal is to distribute all 18,000 doses of the rabies oral vaccine by the end of this weekend. I do have an example of the packets, but we also have a picture here that we can show. But these are small packets that are coated with a fish meal attractant to attract the raccoons. The vaccine is not harmful to pets, I really want to stress that, and more than 250 million doses have been successfully distributed by the USDA previously. We do ask that the community avoid picking up these vaccine packets, but if you do find one in an area where children or a pet may find it, You can safely move them by putting on a rubber glove, using a plastic bag, or using a paper towel, and we ask that after you move it to wash your hands. Please leave the vaccine packets where you found them, again, unless they land on your driveway, porch, or sidewalk, but our goal is to put them into the landscaping or along hedges and things like that, so they're fairly hidden, but they'll be found by the raccoons. If you or your animal come into contact with an open vaccine packet, we do ask that you immediately wash your hands, and if you have questions, or should your pet have an unlikely adverse reaction, please call the number on the vaccine packet or the Douglas County Health Department at 402-444-3400. I do want to stress that the vaccine is safe for your pets, so should they come into contact with the packet, it is okay. The oral vaccine has been tested on over 60 species of animals, including overdose studies. It is very safe for pets, and again, I want to stress that. However, if your dog does find one, we ask that you let your dog eat it. There have been multiple accounts where owners have tried to remove the packet from the dog's mouth, and it's resulted in a bite. I do also want to stress that this operation occurs frequently on the East Coast, where we see rabies variant, raccoon rabies variant. So this is not an unusual circumstance, although it is in the Midwest. We're about 850 miles away from where this variant should be. Other urban cities such as Pittsburgh and Birmingham are urban cities where the oral rabies vaccine has been successful. It's important to note that if we cannot contain the spread of the raccoon rabies variant, it is estimated to cost tens of millions of dollars in human exposures over the next 5 years. During this time, the variant could spread to 5 additional states, including South Dakota, Missouri, Minnesota, Iowa, and Kansas, because the Midwest has no natural barriers to prevent the spread. We also know that raccoon variant rabies results in 2 to 6 times the number of human exposures compared to the 2 variants we do have in the area, those being bat and skunk. And with that, we are happy to open it up to some questions.
How many of these packets, these vaccines, do you expect will be distributed across that area?
So within the 62 square mile area, we're hoping to distribute 18,000 of these packets. Again, there's a picture of the packets there. I do have some here that I can show you, but they are covered in a fish meal. They are safe to touch as long as the packet's not open, but that's why we ask that people wear gloves or use a plastic bag or paper towel, because you don't know if it's open or if it's been punctured. If it is, then you could potentially run the risk of getting the live vaccine on your skin.
The original radius for trapping was 3 miles, I believe. You had said you were going to throw these out to a 62-mile radius. What's the reason behind that?
So the USDA has worked with their wildlife biologists to determine the area for which they think vaccine would be appropriate to, again, kind of do a ring vaccination kind of campaign or program to try to stop the spread of rabies.
Are you taking any sort of requests from homeowners or vice versa who say, yeah, I know there's there's raccoons over in the park across the street, or in my neighbor's yard or behind my church? Are you taking any requests as far as places where within this boundary where you're going to be placing those packets?
Sure, and again, we are really focusing on the 62 square mile area that we had shown the map of. If individuals would like to call, if they have some raccoons and things, and they're more than welcome to call our hotline or our information line at 402-444-3400. If individuals would like to not have their area baited, their yards baited, they can call that number as well.
What can you say about the community while all this has been going on, just their willingness and their helpfulness with these agencies?
Yeah, I think both USDA and CDC have been very happy with the response from our community. I think overwhelmingly this has been a good response for all agencies involved.
Dr. Hughes, is there an update at all on the 10 people who were originally exposed to the kitten?
So the question is there an update on the 10 individuals originally that were treated with post-exposure prophylaxis after contact with the kitten? I have not heard that there has been any negative outcomes. I believe all 10 are doing well and have completed their series. Is that correct? Okay.
Do you guys know if Potawatomi County is doing something in Carter Lake, or do the raccoons just know to stop at the city boundary, or?
You know, they're pretty smart and they just stop. If only. To my knowledge right now, Potawatomi County is not doing their own operations. However, we have been working closely with Potawatomi County to ensure that they are up to date on the situation and all of the operations. If they so desire to start up an operation to respond in that area or other areas along our border, we would certainly help them any way we could.
Last time we spoke, you said you plan to trap, I believe, 1,000 raccoons. Is that still a plan, even with this oral rabies bait going out?
Correct. I believe 1,000 was the goal, and we are approaching 600, I believe. So we're making great progress.
Why are both approaches necessary?
It's pretty intensive to do the trap, vaccinate, and release in terms of manpower, getting people out there to both set traps that are baited, go back out to check those traps and vaccinate and release animals. This is just an additional way that has shown a lot of success on the East Coast in terms of getting that vaccine into wildlife. And it allows us to really do that in a wider area than where that trap, vaccinate, and release effort has happened. And I won't bore you with the details, but there's a lot of math that goes into figuring out, based on potential size of population of raccoons and potential exposure rates and things like that in terms of how many to target.
Is there any theory as to how the variant arrived here in the first place? I know the kitten is kind of patient zero, but is there any thoughts on how it was transmitted to the kitten in the first place?
Great question. So if anyone didn't hear, do we have any theories or ideas about how this kitten here in Nebraska came down with a raccoon variant rabies that typically we don't see here? So we may never totally be able to answer that question. But we think it's most likely that this kitten was translocated here. So essentially there was, likely a mama cat out there that perhaps had rabies and somehow came to Nebraska, could have hitched a ride, could have been brought with somebody. Lots of different ways animals can get to and from other places. She had kittens. This one was exposed. And essentially, because this kitten went up to a home and was found and taken in, and then subsequently developed symptoms and died, and we had a veterinarian who was very on the ball in terms of thinking, okay, this looks like rabies, we should test this cat. That's the most likely scenario. We have not identified, or I should say the USDA and the CDC have not identified any other cases of raccoon variant rabies between here and really Appalachia, other than I think a couple of very isolated cases in Ohio, which is pretty close to that barrier. So, as good as the surveillance system is for rabies in the United States, you would think, if we had a die-off of raccoons with rabies out there, somebody would have picked up on that. That hasn't been the case. So, we really feel like that's the most likely scenario, is that this cat was brought here somehow. We just don't know that for certain. We can't tell you that for sure. We can't tell you necessarily where on the East Coast it came from or anything like that. And it's not likely a question we'll ever be able to answer. The most important thing now is just making sure that if this cat had rabies, if there were others in the litter that maybe had rabies that died and no one knew about it, or it got into other wildlife populations, that we're stopping that spread before it goes any further.
Thank you.
Thank you
All
very much.
right, thank you.
Certainly don't understand 62 square miles as opposed to, is it different from,
Oh.
vastly different from a 6 mile radius?
Yes, thank you for that clarification. We just wanted to ensure everyone was clear that it's not a 62-mile radius, it's a 62 square mile area, which I think is actually a 6 mile, isn't it like a 6 mile radius?
Roughly,
Roughly the same area, a little outside, yeah.
Okay. All right, thank you all for being here. We appreciate it.